Medicare is not free. Let's do a 2-minute overview on the costs of Medicare. Medicare Part A is your hospital coverage. Most of you are going to have a $0 monthly premium. You have to have 10 years of work or 40 credits to get that $0 premium. In addition to a monthly premium, Medicare Part A has some copays and deductibles, but you can get a Medicare supplement policy to cover those gaps. The cost of the supplement is going to depend on your age, your sex, where you live, and which plan you choose. When it comes to Medicare Part B, that is everything outside of the hospital, so doctors, labs, tests, etc. In 2025, Medicare Part B is $185 a month per person in a household. If you are a higher income earner, if you're over certain thresholds, then you're going to have what's called IRMA, an income-related monthly adjustment amount, and with that, you're going to pay more than the standard $185 a month. Now, with Medicare Part B, Medicare is not designed to cover every dollar. Just like Medicare Part A, there are some dollar gaps on an approved claim. So you can have a 20% coinsurance, you have a deductible. You can get a Medicare supplement policy to cover some of those gaps. So again, depending on different factors about you, that determines what the price is going to be. I put most of my clients in plan G or N, but sometimes people also go to a high deductible plan G. Medicare Part C is the alternative to original Medicare. It is private managed care. So if you go to Medicare Part C, you're still paying the Part B premium. But most of those plans have a $0 monthly premium, but they have something called a MOOP, a max out of pocket that you can spend. That MOOP is determined by the plan. It's the most you can spend. And the way you meet it, it's not like a deductible. You pay co-pays and co-insurance as you go up to that max. But just know that the drug costs for Part D type medications at Walgreens or the different pharmacies is in addition to the max out of pocket. It's built into the plan. The most you can spend is $2,000, and that's $2,000 if it's a drug in the formulary. And then there's Medicare Part D. So for those of you that stick with original Medicare, you have Part A and B managed by the Centers for Medicare and Medicaid Services. You're going to want to get a standalone Part D plan. With that plan, you're going to have a monthly premium, and that's going to depend on which plan fits your needs. You always want to match up your drugs to your plan. You also may have IRMA. If you are higher income, Part D's premium is increased as well. And then you do have copays and coinsurance and possibly a deductible as well. And that is capped at $2,000 in 2025. Why are you probably surprised to learn that Medicare is not free? All these years on your paycheck, you probably saw a FICA tax coming out for Medicare. That FICA tax goes towards that Medicare Part A premium free, but for the rest of it, there are some costs.